So this is a topic that was previously neglected, but I thought we should hit on briefly, and that concerns these two mechanisms that we have, and trying to make sense of the fact that we have questionnaires that are triggered as EMAs. This should really say, this is a misleading title. My omissions are yet more glaring. This is really about EMAs and proactive self-reporting, how those interact. So EMAs being ecological momentary assessments, these little questionnaires that pop up in the course of a day, and that is one sort of extreme, and then the other set of extreme cases where we ask someone to press a button to indicate things. I partly am adding this to the boot camp because I noticed some of the groups struggling with what should be actively indicated by the participant and what should be asked in an EMA. What should instead be asked by one of these questionnaires that pop up. And this is a question that we've dealt with on quite a few studies now, and you know, I had some thoughts, none of them terribly deep, but which might bring some worthwhile points to the issue, and I'm sure Kevin and Mohammed could probably bring some additional perspective and insights. So proactive self-reporting, these buttons that we feature. Let's talk about some characteristics of them. Why might we use a button? Why might I create a button? Why go through the hassle of giving it a title and having it appear on the interface? Well, there's a couple reasons that I see. Number one, you can provide a temporally precise marker of certain events. So this event might be an occurrence of smoking or e-cigarette use. And you want to know when that occurred, not merely that it occurred 5 times in the course of a day or that it occurred within the past 3 hours. You want to know when it occurred because you're interested in analysis, such as the analysis being pioneered by Arash back there, to understand how the timing of these different events influence each other. How my using an e-cigarette might accelerate or forestall the likelihood of me grabbing a cigarette, for example. Or you might be conducting an analysis that also Arash will likely be contributing to the work that you'll hear about later today with foodborne illness, and you're interested in understanding the degree to which my eating at a certain location at a certain time might predispose me to gastrointestinal discomfort and even distress. So if you indicate with a button I'm eating and you're at this certain Arash's House of Chicken, then you could look at outcomes for gastrointestinal illness, in subsequent hours that might be suggestive once you total it up against, this person got sick, that person got sick, so, Lisa got sick, and I got sick, and several other people got sick after eating at this certain location, then maybe that would predispose you to think, okay, this particular food location may have some issues with it, right? So we're seeking a temporally precise measure of symptoms or exposures, exposure to food, some care event. I'm taking my medication, right? I'm taking my insulin right now, I'm taking my metformin, what have you. Or a measure of cognitions. If we're trying to understand how exposure to billboards, on the one hand, that's serving as promotions of tobacco in the States, might trigger tobacco-related cognitions in an individual. We'd like to be able to have a temporally precise marker, not only of the exposure, which might be measured through GPS, being an outdoor billboard after all, with the timing of my cognition, my thinking about tobacco use, which might be a risk factor for me then falling back into tobacco use. Related to this, we wish participants to answer questions or document an event with audio or images that benefit from close temporal proximity. So we would like the individual to be able to document barriers to physical activity, or take a picture of a tick which they have found on themselves, so that we can identify whether it's a tick of high risk for carrying Lyme disease. Or we might ask them to photograph some exposure related to a household product that has adverse chemicals in it for breathing, and we want them to document which product they used. So here, ask them 3 hours later, did you use such a product, or did you find the tick? Wouldn't be nearly as useful because we don't have the tick to photograph at that point. They would have discarded it. They don't have the meal that they're eating to photograph, or they don't have the particular circumstance of a barrier to physical activity or support. So another reason for having them trigger something, if we want them to take an action, like to document it, we need it to be right there. And the way to do that is to have them indicate it's here and have them be asked to take a photo. If we seek to lessen recall bias, we might ask them to report a case of eating in a restaurant, because they might forget if we ask them later. This is one of the Achilles heel of outbreak, chasing down outbreak sources for foodborne illnesses. People forget where they eat. You know, if I asked you, where did you eat a week ago today, which location a month ago today, what did you eat and where, you might have a hard time remembering that. Whereas if we have them document it at the time, it might be much less subject to this sort of risk of forgetting over time, even forgetting to the end of the day, right? So we wish sometimes participants to be able to record a passing cognition or affect in the moment, right? So they feel a barrier to a certain action. They want to exercise and they can't, because they don't have, the proper clothing. They don't have the proper, exercise shoes. All they have is formal shoes. Or there's a barrier in the form of concerns about safety or what have you. So we want them, while that cognition is still going on, that, I'd like to, but I can't. The heat of the moment, as it were, we'd like them to document what it is, or a feeling of support, or some moment of truth. My colleague Jeff McDonald, with which several people in the room enjoy a measure of familiarity and even fondness, perhaps. He speaks about moments of truth, about these sort of catalyzing moments where people's perspective on an issue changes because of some encounter, often with another person, which lends them trust or which violates trust. And there's a large literature on this in other areas that Jeff has adapted to health in some interesting ways. And it's one that speaks to healthcare context particularly, but also trust in public health systems, etc. So when someone has an affect, a thought or cognition related to this kind of building up of trust or loss of trust, being able to have them document it right there is important, because they might forget, a few days later what it was that catalyzed this, etc. If we are wishing participants to be active shapers in their health trajectories as part of our study, we want to empower them to contribute to their communities. We want to empower them in a sense of contributing to their positive health outcomes, give them a stake in the game in terms of working with a clinician, say, to achieve health goals. Having them be able to indicate something with a button, to take that step of documenting things can be powerful. And along with that is this wish to share contributions with others. So, one case study of this is we had we ran a study with partners at Harvard last year, which, now was it? It's getting close to 2 years ago, which has since gone on to another study, Mohammed's involvement. But in that study, we were asking people to take photos of tobacco-related promotion and anti-tobacco advertisements that they encountered. Some of them were on TV, and we got pictures of ads on TV. Some of them were billboards. Some of them were ads at gas stations, or cigarette trays, butt trays at bars, or what have you, with promotions in stores where they have tobacco products prominently displayed. It's a different world there from Canada and Australia. And they were asked to take photos of these things. And for most people, they contributed somewhere up to 10 of these photos from around their community. But there was one person in the study who we noted contributed something like 70 photos of his community in a short time. People were enrolled, I think, 3 weeks to 6 weeks, something like that. He got 70 photos from them. And we were wondering what was going on here. What was it that distinguished this individual? Turns out that that the study had captured his imagination. And he actually, by virtue of this study, he got really into documenting the pervasive exposure to tobacco messaging within their environment, and actually became a real anti-smoking advocate, to the point that not only was he taking photos, he was talking to other people about the adverse health effects of smoking, about how they're being pawns to the tobacco companies or what have you. And he actually got his grandfather, who was a lifetime smoker, I think in his 60s, he actually got his grandfather to quit smoking, because he kept on sort of working on him and saying, look, your health is going to be really adversely impacted. Don't you care about protecting your family? Smoking can cause smoke that others breathe in, that can cause them problems. So his grandfather ended up quitting smoking as a result. And it was the fact that this participant got engaged. He was engaged because he had a voice in this study. He could go around and photograph these things, and there was something about that lit him up as a teenager. The fact that he could actually contribute to this anti-tobacco work, and it literally changed, his life and the life of his family because of his engagement. So proactive reporting, yes, it's great for researchers to get added information, but there's something there about human motivation, human inspiration as well to think about. So how have we used this? We've used it in a number of ways. Photographing exposure to messaging, to certain types of behavior, such as smoking and e-cigarette use on the part of other people, such as in the study where Arash is using, in which he's working. Exposure to adverse environments of one sort or another, barriers to physical activity around a community, the presence of graffiti or what have you. And experience of stressors, things that make someone feel stressed within the context of their work. Triggers. Amin this is a notable part of Amin's work, is to document triggers that people might encounter that might lead to adverse affects, so they start feeling a lot worse. They have a confrontation with a with a medical member, if they're a family or someone from outside, they get distressing news on the financial front from a creditor or what have you. Documenting meals, documenting subclinical symptomology, cases where someone might not be drawn to the doctor, but they feel lousy today. And it could have been those meals they ate, or it might have been something else. Maybe it was something about water they drank, or maybe they've got some sort of stomach bug or something like that from elsewhere. So just documenting that symptomology, medication use, so taking insulin for diabetics, and one group here, including with Tina in it and several others like Wade, etc. They're going to be recording taking of pharmaceuticals related to HIV management, these antiretrovirals. And then home-based test results, things like the results from a blood glucose meter where someone could photograph, get a photo of the reading for it. So, this is an example of a button that might be used in this regard. Let's just get rid of that, and there we go. So might share pictures from their community, for example, or share pictures of how your community supports physical activity or how it relates to healthy eating. So people might photograph, community food garden, a community gardening area, for example, on the one hand, such as many students in the room, including Tina and Iden and others grow. Alternative, they might photograph, Kentucky Fried Chicken, in their neighborhood, or some other influence of fast food. So we noted how the Ethica interface could feature these buttons. It's extremely easy to configure. You can get these buttons, and this is the title of the button. And the user can press the button to report the incidents, right? So very simple idea, but I argued that psychologically it has big implications. Now, obviously these buttons differ a lot by different studies. So here's one of the studies that you have on your, this is an older version of Ethica. It's come a long way in the past 9 months. But here I'm going to go bathe in a lake, pond, or ocean, or I'm feeling sick. I heard about an advisory, right? I heard about an advisory that might clue me in to risk issues. There might be a similar thing, for example, for a study of, it was, okay, I guess I don't have it here, for West Nile virus. We're trying to understand how people's exposures to mosquitoes might be shaped by the perception of mosquito numbers, but also by the presence of advisories and also personal protective behavior that they believe reasonably or unreasonably protects them from risk of being bitten by a West Nile infected mosquito. Here's other examples. I'd like to exercise but can't. I'm about to, or I just exercised. I've just weighed myself. Photograph the support for physical activity or document one that's a barrier. These are other examples, giving people a voice. I'm eating right now or I'm feeling sick. That was from the foodborne illness study. Here's another one for Lyme disease. I heard about an advisory. I removed a new tick and I have a rash. A rash being certain types of rashes being pathognomic symptoms of Lyme disease. There's certain bullseye rashes that indicate this. And you'll notice that some of these, it's really helpful to press the button, not only as a temporally precise marker, say, when did you hear the advisory versus when did you go out without personal protective behavior. How did the advisory change your behavior at the micro level? Maybe before you were less likely to cover up your your sock at the ends of your pants with your socks, and less likely to wear long sleeves, and maybe after you're more likely. And by using these sort of buttons, we can document things like this. Removing a new tick, you could photograph the tick. Have a rash, you can ask them to photograph the rash, which might be helpful for judging whether it was indicative of West Nile virus. For influenza, I'm feeling sick today. I received a new influenza vaccine, or I heard an advisory about it. Okay, couple tips in terms of how these relate to questionnaires. Well, one thing is, I would strongly suggest if you're going to use these buttons that you combine it with questionnaires that ask corroborating questions. In other words, that double check the answers, check for missing reports. In other words, cases where they didn't happen to press that button, they were just too busy, they were rushing home, they found a tick, they didn't get a chance to report it, or what have you. To double check the responses, and critically, this can be used, and Kurt and Narges have been in the forefront of this, to estimate the fraction of events that are in fact proactively reported with that button. This is a key advantage. If you can simultaneously get them to push the button, but cross-check it with a questionnaire, it turns out through some simple mathematics, you can estimate the fraction of all button presses that you're getting, or the fraction of all true cases where a tick was found, for example, that are in fact being reported via a button, or the set of all cases of exposures to tobacco messaging that they are in fact reporting. The advice here is keep the number of buttons low and keep subsequent questionnaires short. You don't want them to be, by pressing for a button, be faced with the prospect of a long and burdensome questionnaire. That's going to adversely impact their likelihood of pressing that button. They're going to think of it as the button to get more work. It's like the button to have some painful thing to do. You don't want them to be in that sort of situation. You want them to be able to push the button and with confidence know that within seconds perhaps they can be back to their routine. They don't have to worry about it being a highly burdensome activity. Okay. So we also talked about questionnaires, with experience sampling, ecological momentary assessments that could go off at fixed times or Poisson arrivals in a memoryless way, could go off with a certain chance per unit time, a certain chance per 5-minute interval, for example. And we also talked that they could be contextually triggered by a certain number of people around, or being in a certain location, being in a methadone clinic, as judged by noisy GPS data, and these questionnaires have a number of advantages. We saw how they can include a wide variety of types of questions, types of information elicited, and they can elicit photos and so on, which is very very desirable. A few considerations on questionnaires, and Kevin and Mohammed likely have some notable additions to this. One has to balance the size of the questionnaires, the frequency of being asked, to understand the burden associated with them. I put a third variable in there that Rifat is looking into, which is when these are asked. When you pop the question. Because a given questionnaire asked at the right time might be perceived as a lot less burdensome than the same questionnaire asked at a very inconvenient time in the hustle and bustle of certain periods of the day or what have you. We noted that there's some particular types of questionnaires in Ethica: eligibility, entry, study completion, opt-out, as well as the sort of EMAs, the routine questionnaires or generic questionnaires, as they're called in the Ethica interface. I noted that it's potentially powerful. I don't know how many people have actually used this yet. I think it's an under-tapped resource, partly because I don't think it's exposed to the CSV file that you can download at all. But there is information on timing of completion of every question. And some of our partners, I don't know, Andrew, if you know Terry Flint from, he was at Center for the Study of Choice in Australia. He's an Aussie who's sort of in Jeff's circle on orbit, or what? Not quite orbit, but he's in that milieu, and he's involved in conducting discrete choice experiments for health.
Oh, I have heard talk about him.
Yeah, that's his specialty. He's very interested in this issue of securing exact timing information when people answer each question, because he's interested in how long do they spend considering each question, and ideally it can be coupled with eyeball measurements, but that's another issue. But there is a question limitation. Be aware of different screen size limitations for questionnaires. They can appear rather different and perhaps more more overwhelming for certain types of screen sizes, because it seems like it goes on forever, whereas in other cases it's very clear what the size is. A big discussion that was implicit in the discussion that Mohammed had was the choice of multiple pages versus single pages for these questionnaires. And I think psychologically there's some trade-offs there that I'm not fit to speak on fully, but the issue is that you can spread the given set of questions out across multiple pages, so at any one time you only see one question, you press next, and then you see the next question by itself, versus having all the questions on one page. Some of those trade-offs involve confusion. For example, if you have a contingent question, a question which is conditional, it's being asked is conditional on your answer to an earlier question, we found that some participants can be a little bit confused when they answer an earlier question one way and that question gets grayed out, that later question gets grayed out, the contingent question, and they're wondering, okay, what's going on? They don't understand the notion of disabling it because of what was answered earlier. They come to it and they say, how do I answer this? And they weren't clear that it was disabled because of earlier. Whereas if it's multiple pages, you can just skip showing that. They don't actually see the contingent question. It's not visible to them, so they're not aware that it's there, and don't try to answer it. Instead, they're not even aware of it. And that may mean out of sight, out of mind. On the other hand, if you see all the questions on one page, I know psychologically sometimes it could be clear what the span of the survey is. Oh, I'm only being asked 3 questions. This should be really painless. This should be quick. And you just whip through the questions there. So I think there's some trade-offs there also with form factors of devices, smaller screens. It may be better to put successive questions on other pages so there's less scrolling down or needing to go up and down on the page. The questions are always nice on the top of the page and you can go between them. Whereas with bigger screens or tablets, including tablets, you might find that having them on one page is just the ease of simplicity, because you could just click bum 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 right on that page, and you don't have to scroll and you don't have to press next to the next page. So there's some trade-offs there that probably our colleagues in HCI could do some interesting could contribute some interesting comments to this, and maybe even pursue some experiments with Ethica. Mohammed, a question, and Kevin, I'd count both of you more usability aware and sensitive than I am. Do you want to add any comment on this issue? Multiple pages
I think
versus
it's
one
less
page?
less of a study dependent factor than usability issue, as you mentioned.
Yeah.
You mentioned that like we originally had that you could enable or disable a question. If question was disabled, it was grayed out.
Right.
And that made a confusion that, oh, is it disabled? So what should I do with this? Should I skip it, just not answer it?
Right.
One thing that we did in iPhone and we are testing it is that we show and hide the question in the same page. So the question just slides out if it's enabled, or slides back in, or just it fades out if it's disabled.
Sweet.
So it's not shown, but still that has the downside that you have multiple questions per page. So one thing that Amin right now, Amin T, the other Amin, is looking into, there are actually some interfaces, some online data forms or some mobile data forms interfaces that they only show one question at a time. Doesn't matter how you design it, they only show one question at a time. The advantage, even on the screen, even on the PC, that you have a lot larger screen than on the phone. And the argument there is that you should only focus on one question at a time, and you should not see anything else. So it's actually very, very good and pleasant user interface to work with. I've used a few of them. So one thing that we are actually looking at right now is that regardless of how the questions are arranged in the survey editor, the way that we show it is just one question at a time. Now it needs a bit more use cases for us to understand if actually there is any scenario that you might need you really might need multiple questions in one page. So far we haven't found any scenario that you would say you really need these two questions to be seen at the same time.
I mean, I can imagine where one of the questions is something like you submitted a photo and then you're being asked to comment on that photo, that it might be handy to be able to look up.
The logic there is that usually these questions should
be
one
grouped.
question.
Yeah.
Should be grouped. Like for example, the other is
Totally.
that selecting multiple options and one of them is other, and if you pick other, you have to explain something.
Right.
This is in fact one question.
Logically, yeah.
So
Yeah.
the
I
point
understand
being
what you're
that you
saying,
want
yeah.
to just show one question at a time. Now, might have
Sure.
multiple elements. As for example, our audio text question is actually like
Exactly.
one question but has multiple elements.
Yeah. So that gets to this. Thank you. I don't know, Kevin. Do you have anything else that you want
I
to add?
would concur with that. The only question: does the current version of Ethica have a completion bar?
No, that's something that's
Have
very,
a
very
what?
helpful.
Have
A completion
autocomplete?
bar. No, a completion bar. How far?
Oh, how far along?
So
No,
I think
we've
the-
talked a lot about that.
The gold
and-
standard is
Yeah.
multi-page with a completion bar.
Yeah.
Yeah.
Because then you've got the
Always one question.
always one question, but you
common
have some
location.
context about how much longer.
How
this
far
will
you?
go on.
Yeah.
Indeed. Okay.
So it's more of I think it's more of a user interface side than a study design side, and we hope that in the future presentations of yours, we can just take that bullet point out and say, don't worry about it, it's already like the best case it can be.
Yeah.
So you don't have to consider this factor.
Right. Okay. So a question here, or a comment here. There's this type of question, which Mohammed, I don't think you dwelt on it much, but basically it's a choice between either text or audio. It's one question. You can choose between these two, and I've had rather favorable impressions of that question. I've used it a lot myself, and I think it's an attractive combination. But it does require, just be aware that if you're going to record audio and you're going to use it to record voice, someone's got to do the work of turning that into text. And while despite the fact that we're in a world of Cortanas and Series and Dragon Naturally Speaking, they're not going to be able to just automatically turn it into text for you. We're far from the case of uncalibrated voice for large vocabularies being able to be reliably, guaranteed level of transfer. So, we're talking about a situation where there's going to be some sort of transcription burden, and we are, in a situation where there's a lot of active interest in possibly leveraging some voice recognition technology under very limited vocabularies or as a first cut for later transcription. But there's going to be work involved, and if you don't have the staff or help to be able to handle that transcription burden, you might want to just stick with freeform text and go with that, because it's a simpler option and one that could be more readily analyzed. Kevin, yeah.
So this is kind of a double-edged sword. On the one hand, audio freeform is more burdensome to the researcher.
Yes, but less
It's
to the
much less burdensome to
Indeed.
the participant. And so it really comes down to how often do you expect that freeform text to be required. If every time you're doing a response, you need 3 sentences worth of freeform text, that's going to become a burden on the participant. Because typing on a smartphone, 3 sentences is a pain.
Yeah.
If you do that 3 times a day, it's going to become an issue. And you should probably just assume that you're going to have to check down to audio and budget for transcription. There is an additional caveat to that, though, in that when you start opening up the audio channel on a regular basis, your ethics can become more nuanced, because you
may record background
you
conversation.
get background conversations. I think the one with Larissa, we had one where the participant was providing an audio response, and in the middle of the audio response got into an argument with their spouse, and then didn't press stop, and so we've got the entire argument with the spouse as part of our audio response that now has to be dealt with in an unethical way, right? So there are kind of pros and cons, and it's something you have to very carefully balance when you're doing your studies.
Right, and I would just highlight, there's some interaction between that and retention and vulnerable populations as well. If you're dealing with individuals who may be uncomfortable with cell phones in the first place, may have spelling difficulties, low socioeconomic individuals with little background, individuals who, for whom expression in the language of the interface is not so comfortable. Actually, providing recourse to audio may be both sort of less burdensome, but also less intimidating than being asked to type out things. And also there's classes of individuals who for whom typing on the smartphone is very difficult. It's very difficult. And again, you may lose them if they think they're going to have to be typing a lot as part of this at time of enrollment. They realize, I'm not going to do this. And it may lead to, much lower involvement in terms of contributing things. So it's an issue where I think it has some gravity, and it's maybe worth doing some experimentation, at the feasibility level. It's a very attractive option for certain subgroups, and it's the sort of thing which should be factored into study planning. Obviously part of that is this whole idea of, or related to that is this idea of enabling multimedia responses. For example, photos of things that people saw. So instead of describing it, they just take a photo. That can lower the burden. Picture can be worth 1,000 words there. So in terms of this notion of triggering questionnaires, based on circumstance. Where does that fit in? Well, there's, I would say that, this is not the most common way of providing questionnaires by any means, but we have used it, and when it's used, it could just be tremendous in terms of its implications. So an example would be questionnaires that might be asked when you're in the presence of a certain number of discovered people who are also in the study. So we've done that for several studies now, including the Harvard study, where it's a big piece. And not only others, participants in general, but participants in your tight social network, your network of close people with whom that you've been associated. And maybe you get a different questionnaire. And in fact, I think it is the case. You get a different questionnaire if that's a smoker nearby you or a non-smoker, for example. You can imagine using that to trigger things in dyadic interactions between, children and their parents, for example. Using it to trigger something based on location. So when you're in a methadone clinic, asking a question. When you are in a vehicle, or when you're in a known food vending area. It might ask you a question about, food use or what have you. Questions after a certain amount of sedentary behavior, following a long period of not traveling to. This is one of the ideas I remember we had written into the first Good Food Junction grant that I worked with Rachel on. That was when Kevin was on sabbatical. And one of the ideas there was, triggering questionnaires that might probe reasons for not having gone to the Good Food Junction within a certain period of time. What barriers might there be? Motivations for engaging in some measured activity, maybe exercise or lack thereof, for use of some resource. Maybe it's a recreational resource or what have you. Relationship to the detected resources, your relationship to these people. How many of the people around you do you know well? Do you know both their names? Was a question I remember using for one study, if I'm not mistaken, or to a certain location. And asking about risk perception and intention. So, asking when someone goes outside and has spent a significant amount of time outside, asking a question about risk perception related to mosquito exposure or what have you. What are some pros and cons of these? Well, there's some cons. Often, really, a big con should be in here. One is that that it can require custom development, which can slow down a study's deployment. Doesn't always, but may be required. Another con is that there's analysis needs to take into account the triggering condition when you're reasoning about it. It's not a neat Poisson arrivals or fixed time where the contextual factors aren't germane. In fact, it's fully triggered by the context. And there are risks of false negatives here where you've missed certain situations, you've missed certain encounters, and you've only gotten other ones. You've missed encounters where people have left their smartphones behind and there's a social grouping, but you haven't captured it. Or you've missed encounters, or you've missed exposures of an individual to a methadone clinic just because they didn't bring their phone. So there's definitely cases of false negatives, and then there's false positives, cases where you think they're in a fast food restaurant and they're actually not. So it's not perfect, certainly by any means. In terms of pros, well, you can ask about the motivation or intention behind behaviors that might be observed. You can trigger questions at temporally proximate times. You can enhance response rates by choosing the time carefully rather than just asking at all through the day. Have you eaten in the past hour? You might be able to ask a question that's more likely to elicit a relevant response. You can lessen recall bias by asking about their attitudes towards a park at times proximate to their being in the park. You can use to cross-check sort of classifications that may be carried out through analysis mechanisms, something we'll be talking about. And you can use these questionnaires to disambiguate cases. You don't have to be perfect in triggering the questionnaire. When you think they might be smoking, you can ask them, "Are you smoking?" And that will help you both refine your algorithm and help you be more confident. Okay, when they are smoking, that they are smoking. So we'll ask these questions that are more germane. So the point is, even if you could use this to be roughly good timing, you may be able to lessen burden compared to just asking many times during the day. Okay, so this was some comments on ecological momentary assessments, proactive self-reporting, some of their trade-offs, some of the strengths of each. Any questions related to this? Comments? I think both these are powerful things with psychological import that isn't always obvious at first glance. Okay. I think I'll stop here. Kevin, do you want to give something on the the sensors? Yeah.
Yeah, sure.
Is that
I
viable?
think that makes sense.
Okay. Good. Timing seems favorable. Great. Okay, so I will stop reporting. Can we get you,
That's probably
Kevin,